if we just go to a restaurant and don't make reservations, but she'll tell him that he has, a lot of times she'll say he has a rare form of dementia. Can we have a table in the back against the wall out of the mainstay? And, but, and then when she does, if we're going somewhere a little more fancy and we need reservations, she explains them when she makes the reservations, so that I'm away from the noise of all the conversations going on.
If restaurants had a place where you would come in and say, there's dementia in our group, and they had a place for that was quiet and away from children and away from noise and things like that would be very helpful. Or have something in their window that says, we're dementia friendly, that we know that they have some education in dementia and will be able to handle it if someone comes in and starts asking questions that don't make sense or ask the same question over and over. And if communities would educate themselves about dementia and how they can just treat people like they're people. And if they don't understand, there's usually somebody with them. So if they just understood that they're still people and they still want to go out to eat and they still want to go to the movies and they still want to do things that everyone else does. And it becomes uncomfortable sometimes when the establishment does not understand what's happening. And so if communities were more aware of what dementia means and that there are different dementias and people can be very young. Frontotemporal dementia can come on as early as your 20s, and no one expects someone in their 20s or 30s with small children to have dementia, but that's what happens.
Where people will look at me and they'll see that I'm having a difficult time, and they'll just step over where I am and take my plate of food or whatever it may be, or whatever situation I find myself in. And it's amazing what people will do and can do a lot of times, for those that do have some handicap.
Or how would you want to be treated by the clerk?
To know enough about what she was seeing, that she could say, is there something I can do to help you, or something like that.
I do feel bad. I grieve for Steve because he was such a social animal in Savannah, and it has been hard. We visited one particular church and examined a lot of their groups, but there just doesn't seem, and maybe we haven't tried hard enough, but there just doesn't seem to be a social group for Steve's particular place in his life, and one that he would seek to be a part of. As a caregiver, as a person who works full time, and also as a caregiver, that it is truly, it's truly a second job, and it's truly sometimes it's a struggle. And that I've looked at support groups, attending support groups, but a lot of the support groups are actually in the mornings and during the day when I'm working, and then a lot of times at night I'm just once I get it all done, I'm just too tired to go.
This is a nice place to come. Everybody's friendly and everybody is supportive, and so that kind of environment is helpful to the patient, me, because, I feel more comfortable. I feel more relaxed. I'm not trying to focus on what I'm saying or what I shouldn't say or whatever. I'm just going to be myself. And that's exactly what I do. And that seems to work out fine. So I think that even though at some point in time we have discussions about what we need to do for ourselves in the way of medications, or in the way of treatment or whatever, then that's another issue. But for the most part, this is an interactive environment that supports mental health in the way of engagement and allowing the patient to open up and express himself or herself, and also have some interaction that is meaningful, which is something that we all need. There should be a clearly public information that there is help available right here where you are, and that you could be referred, or you could be seen, or you could have someone come and see you and have a discussion with how you can be helped. And I think that would go a long ways toward giving the community a lot better support.
Making the community more aware that you have people out there with this disease, and kind of like an awakening to get the community to start thinking, okay, what can we do to help this situation?
On a really serious side, short of wearing a sign or having a badge on that says, I have dementia, watch out for me, he's made his safe world, but a lot of people haven't. And if they go into a setting and all of a sudden they're acting differently, people don't know how to handle that. I mean, who knows? What if they call the police or somebody? I mean, the whole entire community needs to be educated on different scenarios. I just think every professional that works in the community going out to people's homes need to be aware somehow that person has dementia.
So they made sure that we were able to go into the health room whenever he needed to go to the restroom, rather than having to either chance me in the men's room or him in the ladies' room and someone else coming in. So they made it very easy for us to be able to do the things that he needs to do normally, but in a safer environment. It's not something dealing with old age per se. You can be 30, 35, 20, and still see these signs and try to get the help you need. I would ask them to find out more about the different types of dementia. I, as an advocate for FTD, and he was diagnosed with the behavior variant. As an advocate, I do carry pamphlets with me all the time, because you never know when something can occur. So I always try to find a way to educate someone if he does something differently, and I found that it helps. So anytime you see someone doing something that maybe doesn't look normal to you, don't feel as if you can't go and ask maybe that caregiver or that partner that's there if everything is okay, or if there's anything you can do, because you may learn something about that person or why they're doing that may be helpful in your own home or in your own community.
I just think education is the key. And obviously the GGS is doing that, the Alzheimer's Association, Rosalind Carter, obviously Emory, at least locally. And I think that's just the key is, it's fairly new, and it was kind of shunned, or the persons with Alzheimer's were kind of shunned, and they were just kind of ignored, or people didn't know how to deal with them. But I think, again, education, that, these are regular people. This is what we can expect. And